Hello guys and welcome to a new series. This time we are going to discuss the antibiotic pharmacology. This is controversially the most important drug group and it is prescribed to patients very often, and so you are going to encounter these drugs very oftenly during your practice. So in this series we are going to explain those groups or families of drugs, and this video is going to be the basic information that you're going to need in order to build up to learn the more advanced stuff. So in this video we are going to talk about the main idea behind the antibiotics, and we are going to also explain the gram-negative and positive bacterial cells and how the antibiotic is going to affect them, and we are going to explain the classifications of antibiotics and the different classifications that we are going to use and how to apply them on the different antibiotic groups. And we are going to explain the bacterial resistance, the antibiotic combination, and the general side effects of antibiotics. So let's start. So let's start with the main idea behind antibiotics. So antibiotics exploit the differences between the bacterial cell and the human cell here to harm the bacterial cell and not harming the human cell. So here we have bacterial cell and here we have human cell or animal cell in general. And the antibiotics are going to exploit the differences to harm the bacterial cell and not harming the human cell. Bacteria and not human. So what are the differences between the bacterial cell and the human cell that the antibiotic are going to exploit? So first we have the cell wall. The cell wall in the bacterial cell is the bacterial cell have a cell wall while the human cell does not have that. So we can have an antibiotic that work on the cell wall that destroy the cell wall of the bacteria. We also have the cell membrane here, which is different than the bacteria, and this is also there's also antibiotics that work on the cell membrane of the bacteria rather than the human cells. And also we have the ribosomes. They encode for different proteins than the human cell, so we can give antibiotics that affect the bacterial ribosome. And also the bacteria does not have a nuclear membrane or have defective nuclear membrane in comparison with the human cell that have a complete nuclear membrane that protect the DNA. So we can give an antibiotic that affect the bacterial DNA and not affect the human DNA. And we also have the metabolic pathways, which also can be targeted by antibiotic that affect the bacterial cell. So those are the main differences that we are exploiting while treating bacterial infections. Now let's talk about the gram-positive and the gram-negative bacterial cells. So this idea of the gram-positive and negative starts with a scientist called Gram that did experiments on the bacteria with a crystal violet stain that's called the crystal violet, and this would stain the bacteria into the violet color. And what he found after experimentations, he found that some of the bacteria would be stained by this stain and others would not be. And after research, he found out that the bacteria with a thick cell wall would be stained by this stain, and a bacteria with a thin or defective cell wall would not be. So bacteria with thick cell wall would be stained by the crystal violet stain, and that's why we call it gram-positive bacteria. So gram-positive bacteria. So this one here with a thick peptidoglycan layer would be stained and it's called gram-positive. But the bacteria with a thin or defective cell wall would be not stained. With thin cell wall would be not stained and would be called gram-negative. And this is here the gram-negative bacteria. So the gram-positive have a thick cell wall. The gram-negative have a thin cell wall. Now you might imagine that the gram-positive bacteria would be harder to kill because it have a thick cell wall, but that's not the case because the gram-negative bacteria would have another layer of membrane, and that's called the outer membrane. The outer membrane is very selective for the gram-negative bacteria. It would let the nutrients and the good materials will go into the bacteria and would prevent the other molecules that might harm the bacteria. So this outer membrane is very selective, and that would make the gram-negative bacteria harder to kill than the gram-positive bacteria. Yeah, so that's the idea behind the gram-positive and negative, and we are going to use those classifications, the gram-positive and negative, a lot in this course. Now let's talk about the classifications of antibiotics. So antibiotics are classified according to the source. So source of antibiotic, and that would be, we have natural antibiotics and we have synthetic and we have semi-synthetic. Example for the natural antibiotics would be the penicillin and the aminoglycosides group. So aminoglycosides. Example for the synthetic antibiotics would be the quinolones group. And the semi-synthetic antibiotics, we have the ampicillin, because we have the original penicillin is a natural and we added some materials to it, so we have ampicillin, which is semi-synthetic. Antibiotics is also classified according to the mode of action. So mode of action, we have bactericidal antibiotics, and we have bacteriostatic. Bactericidal meaning it kills the bacteria, so kills the bacteria, while the bacteriostatic antibiotics would arrest the bacterial growth. Now the antibiotics is also classified according to their mechanism of action. So mechanism of action, and according to the mechanism of action, we have 5 groups of the antibiotics. We have cell wall inhibitors, and those work on the cell wall. They destroy the bacterial cell wall, and examples for those are the penicillin, the cephalosporin, we have the vancomycin, the carbapenems, the monovenom. All those would work on the bacterial cell wall. We also have antibiotics that work on the bacterial cell membrane. So cell membrane, and so on this layer here, they would work here. And those examples for those are the isoniazid, which work on the Mycobacterium tuberculosis bacteria. We have the azoles, which are, and the nystatin, which work on the fungal infection. So we have cell wall inhibitors, we have cell membrane inhibitors, and we also have DNA inhibitors. They inhibit the synthesis, or they destroy the bacterial DNA, and examples, so they work here. An example for those would be the quinolones, so quinolones antibiotic group, and we have also the rifampin. And we have also antibiotics that work on the ribosome, which is the protein synthesis, and those are work on those here. And examples for them would be the aminoglycosides and the tetracyclines. So aminoglycosides and the tetracyclines. And we have antibiotics that work on the metabolic pathways, like the sulfonamide group. So metabolic pathways, so they interfere with the folic acid synthesis in the bacteria, and example for those would be the sulfonamide group. Now, if we apply the second classification, which is the bacteriostatic or bactericidal versus bacteriostatic to this classification. So bactericidal and bacteriostatic. So the cell wall inhibitors would destroy the cell wall. They would destroy the main pillar that is holding the bacterial cell together. So those would be bactericidal. So cell wall inhibitors would be bactericidal. The cell membrane is also holding the cell integrity, so it is very important for the cell survival. So if we use an antibiotic that affect the cell membrane, we would also get a bactericidal effect, so it will kill the bacteria. DNA is also very important to the bacteria, so it would also get the bactericidal effect. Now for the ribosome or the protein synthesis, it depends on the protein affected. So if it is an important protein to the bacterial survival, we would get a bactericidal effect. And if it is not important to protein, we would get a bacteriostatic effect. So it is variable. So we get bacteriostatic sometimes, and some other times we get bactericidal. And metabolic pathways, we are affecting the cell metabolism, and this is not affecting the cell survival, so it would have a bacteriostatic effect. So bacteriostatic. So now let's talk about the bacterial resistance. So bacterial resistance is resistance to antibiotic, resistance to antibiotic, certain antibiotic, when the antibiotic is available at max concentration, at max concentration tolerated by the host. So the bacterial resistance, we have two types. Resistance. We have the innate resistance. Innate resistance is that the bacteria is resistant to some antibiotics by default. Like we have the Mycobacterium tuberculosis, so Mycobacterium TB have a very thick cell wall, so it would be resistant to a lot of different antibiotics. And we also have most of the gram-negative bacteria are resistant to antibiotic called vancomycin. So also another example is that most gram-negative bacteria resistance to vancomycin. The other type of resistance is the acquired resistance. And the acquired resistance on two types. It is either acquired by horizontal or vertical transmission. So horizontal or vertical transmission. The horizontal transmission is that the bacteria would have a piece of its DNA is cut and it is being delivered to another bacteria. This bacterial piece we call the plasmid. So in horizontal resistance we would have plasmid going through to other bacteria. In vertical transmission we have the bacteria transmitting its resistant genes to the bacterial daughters. So it would have its genes transmitted to the bacterial daughters when it undergoes binary fission, which is how it reproduces. The other type of acquired resistance is by modification of normal function. Some bacteria, when first it introduced into antibiotic, it would be very susceptible to the antibiotic and it would die very quickly, but then it would develop resistant patterns to the antibiotic. The resistant patterns, like it produces or secretes enzymes that lead to the lysis of the antibiotic, like it secretes beta-lactamase, which lead to the lysis, or it would lead to an activation of penicillin. Inactivation of penicillin, so the penicillin would not be effective against the bacteria that secreting the beta-lactamase. And this mode called the enzymatic inactivation. Other bacteria would decrease the permeability of its outer membrane to those antibiotics, like in gram-negative bacteria. When the antibiotic goes through the outer membrane, the bacteria would identify the antibiotic and it would decrease the permeability of the outer membrane to the antibiotic. So we would get decreased permeability. Like in gram-negative bacteria, the outer membrane would be more selective and it would lead to decreased permeability to antibiotic. We also have in metabolic pathways. So when the antibiotic would inhibit a certain metabolic pathway, the bacteria would develop an alternative metabolic pathway. So alternative pathway. And also when we give antibiotics that affect the ribosomes, it would affect a protein synthesis. So the bacteria would have a mutation in the binding site of the antibiotic, so it can't bind to the ribosome. So action site mutation, action site mutation. So again, resistance is resistant to antibiotic when the antibiotic available at max concentration tolerated by the host. And we have two main types of resistance. We have the innate resistance, which is resistance by default, like Mycobacterium tuberculosis would have a thick cell wall, and this would be very resistant, so we would give 4 types of antibiotic just to treat that infection of the TB. And we also have most gram-negative bacteria would be resistant to vancomycin. The other main type of resistance is the acquired resistance, and it is also on 2 types. We have the horizontal and vertical transmission, and we have modification of normal function. The horizontal transmission is that the bacteria would have a piece of its DNA cut, it's called the plasmid, and it is transferred to another bacteria. So the other bacteria would have the resistant genes transferred to it, so it would be also resistance, same as the original bacteria. And we have the vertical transmission, which is when the bacteria reproduce, it would lead to a transmission of the resistant genes to the daughter bacteria. So the daughter bacteria would be also resistant to the antibiotic. Now, modification of normal function, we have different modifications, like we have the action site mutation in case of the antibiotic binding to ribosome. So the bacteria would mutate the action site of the ribosome, so the antibiotic can't bind to the ribosome. And we have the beta-lactamase, so some bacteria would produce the enzyme that would inactivate the antibiotics, like the beta-lactamase. And we have the decreased permeability, so some gram-negative bacteria would have a decreased permeability of the antibiotic through the outer membrane. And we have alternative pathway in case of the antibiotic affecting a certain metabolic pathway, so the bacteria would develop an alternative pathway, so the antibiotic would not be effective against this bacteria. Next, let's talk about the antibiotic combination. So combination is when we combine 2 or 3 or even 4 antibiotics together to treat some type of infection. We use the antibiotic combination when we have a mixed infection. Mixed infection meaning infection with different type of organisms, like gram-positives, gram-negatives, anaerobes, such as in the diabetic foot, and also in peritonitis. So in those infections we have different microorganisms in those infections, so we need to use combination of antibiotics to treat that. We also use it in severe infections, such as the meningitis, so we need to use different or combination of antibiotics. And it's also used in resistant bacteria. Such as the Mycobacterium TB, Mycobacterium tuberculosis, we usually use 4 different antibiotics to treat this infection. Now let's talk about the effect of the combination. So effects of the combination. So if we combine a bactericidal antibiotic with a bactericidal, so bactericidal antibiotics with a bactericidal antibiotic, we get a synergism. So synergistic effect. Synergistic effect means the effect would be much more better than the effect of the both of the antibiotics alone, of each of the antibiotic alone. And that would be, such as example for that would be when we combine the penicillin with aminoglycoside. So the penicillin would affect the cell wall, it would inhibit the cell wall of the bacteria, and the aminoglycoside would be more free to enter the bacteria because we already destroyed the cell wall, and it would affect the protein. So we would have synergistic effect when we combine those. Now if we combine a bacteriostatic antibiotic, with a bacteriostatic antibiotic, we get an addition effect. So the effect of the bacteriostatic antibiotics would be summed up. This would be lesser effect than the synergistic effect of the bactericidal plus bactericidal. So bacteriostatic would give us an addition effect, and this would be such as when we combine a tetracycline antibiotic with a macrolide like erythromycin. We would have an addition effect. Now, if we combine a bactericidal with a bacteriostatic, so bactericidal plus bacteriostatic, the effect would be variable. And most of the times, the effect would be bad. It would be less than each of the drugs alone. Example for that would be when we combine penicillin with a tetracycline. So penicillin plus tetracycline. The penicillin is effective mostly when the bacterial cells are active and they are undergoing binary fusion. So it would affect the cell wall of those bacteria and it would lead to their death. But the tetracycline antibiotic would decrease the bacterial binary fusion or the reproduction of the bacteria. So the penicillin effect would be decreased or diminished. So the penicillin plus tetracycline would give us bad effect. But sometimes we get good effect, such as when we combine the penicillin with a sulfadiazine, and this will give us good effect because those drugs both would go into the cerebrospinal fluid and are used in treating meningitis. So they would be good in treating meningitis because they both would go through into the cerebrospinal fluid and they would treat meningitis very effectively. Now let's mention the antibiotics chemotherapeutic spectrum. We have narrow spectrum antibiotics, and that would be the antibiotics that affect one type of bacteria or a limited types, such as the isoniazid that would affect the isoniazid. It would affect the Mycobacterium tuberculosis, MTB, only. So it would have only effect on a single bacteria, which is the Mycobacterium tuberculosis. We have the extended spectrum antibiotics. So extended spectrum, and such as the ampicillin, it would have effect against, so in the extended spectrum antibiotics, we would get effect against most of the gram-positive bacteria and some of the gram-negative. So the ampicillin would have effect on the most of the gram-positives and some of the gram-negatives. Now, in the third type is the narrow spectrum, extended spectrum, and we have broad spectrum. Broad spectrum antibiotics. So those would have effect against a spectrum, a lot of different bacteria, such as gram-positives, gram-negatives, anaerobes, such as the we have the tetracyclines. They would have a broad spectrum of chemotherapeutic effect. So finally, let's talk about the side effects of antibiotics. So we have general side effects, and we have a specific side effects. The general side effects that happen with most of the antibiotics. The specific side effects happen with every antibiotic would have a specific side effect that's related to that antibiotic. So regarding the general side effects, we have the allergic reactions, and those would happen mostly with the penicillin and the sulfonamide group, and those would be effects such as rash, edema, urticaria, Stevens-Johnson syndrome, and a lot of different stuff. And we also have decreased levels of vitamin B and K. So decreased levels of vitamin B and K because the antibiotics would kill the bacteria that produce these vitamins in the GIT tract. And when the vitamin K level decrease, we would get the patient complaining of bleeding under the skin, which is called petechia. So if the patient is complaining of petechia, it is important to stop the antibiotic because it is affecting the vitamin K levels, and that's very dangerous. We also might get super infections. Infections happen when the antibiotic would kill most of the bacteria of the gastrointestinal bacteria, and it would leave the resistant GIT bacteria, such as the Clostridium and the Pseudomonas, and the fungi such as the Candida. So we get those infections like the Clostridium infection when the Clostridium bacteria would become dominant in the GIT tract, and it would release some toxins that would lead to the necrosis of the superficial layers of the GIT, and it would lead to diarrhea and abdominal pain in some patients. When we get this infection, we would stop the broad spectrum antibiotics used because it mostly happens with the broad spectrum antibiotics, and we would give the patient metronidazole because this drug would work on this type of bacteria. And sometimes we also might get in the fungal infections like Candida and the in the oral cavity and in the pharynx, and those would be treated by stopping the antibiotic causing that super infection, and we would give the patient antibiotic that affect this type of organism. And with that, we reach the end of this video. Thank you guys for watching. Please like this video, share it with your friends, and subscribe to the channel, and see you next week. Peace.